Human beings are complicated, probably the most complicated phenomena in the known universe. We're conscious beings, aware of ourselves and the consequences of our actions, yet we continue to think and act in ways that cause immense suffering to ourselves, other people, and to the natural world. As therapists, we're deeply involved in trying to alleviate human misery, but we're also in the business of evolving human consciousness. Each person we see, each person who changes their experience for the better, is like a pebble tossed into a pond. The ripples spread out, affecting those around them, family, friends, and even strangers. We are a force for good, changing the world and human relationships, one person at a time. As such, we're at the forefront of the development of human consciousness. The practice of psychotherapy is less than 100 years old, so it is quite primitive. While there's been tremendous improvements and developments in our understanding of human behavior and human psychology, we do not really know enough to be completely effective in promoting positive change. In the future, they'll look back on our therapeutic methods and shake their heads at our bizarre ideas and practices, just as we think of the medical use of leeches and bleeding to heal people 150 years ago. We have to be well versed and grounded in our known therapeutic methods, but we also have to take them lightly, knowing we do not know all that we need to know. We're doing our best with the tools we have, but often we have to make it up as we go along. All of us, at one time or another, have the scary sense that we are not doing therapy right and will be found out to be imposters. This video takes a step back to look at the bigger picture on what it means to be a therapist. I ask you to think deeply about your own and others' therapeutic methods and expand your view of what is possible. Because we do not know enough, because human beings are complicated, a holistic and inclusive attitude to therapy has to make sense. This is not random eclecticism, but a considered and inclusive realization of how different approaches can be used effectively and appropriately with different clients at different times. To do this, we need to first understand the many different models of psychotherapy, their uses and limitations. Unlike the hard sciences, psychology and psychotherapy do not have an overarching theory of human beings. We have elaborate hypotheses, but mostly models of particular aspects of our human functioning. So we need to understand what is the nature of these models. A model is an informative representation of an object, person, or system that shows the main aspects and how they are related to each other. It takes something that's complex and makes it easier to get our minds around. Think of a model airplane or an architectural model of a house. They show the main aspects and how they're put together in a simplified form. In therapy, we use models of how human beings are constituted, what techniques evoke psychological change, and what are positive outcomes. These guide our approach and what we do in each session. Some of our models are learned in trainings, some built from experience, and some intuitive. So what do therapeutic models do? Well, they influence the type and quality of the therapeutic relationship. That's very primary. They focus our attention on specific aspects of a client's presentation. They define what is relevant and what constitutes a positive therapeutic outcome. They structure information gathering and techniques, and they define how experiences are causally related. So, for example, do we listen to what the clients say or what their nonverbal communication suggests? We will understand this depending on the kind of model we use. So it focuses our attention. Do we ask about clients' interests, or do we just talk to them about their problems? In some models, They might be very open to looking at positive aspects of a person's experience. Other models don't do that. So do we listen without comment or ask questions? So some models will just make us more passive. Other models will make us more active. And then are our questions specific, as in, say, problem-oriented therapy, or are they open-ended? What is a successful session? What is a positive outcome? How do we know when to finish, to terminate our therapy? And is that determined up front, or is it decided as we go along? These are all questions which are in some sense determined by the models that we use. And of course, there are some therapists who believe that feelings are more relevant than thoughts, or vice versa. Do conscious attitudes determine our behavior, or are unconscious motivations most relevant? Again, these are questions determined by our models. We've looked at the nature of our therapeutic models, but what is a global and inclusive definition of psychotherapy? I believe it is an intentional interactional relationship between two or more people designed to promote positive change and development. If we look at this definition, it has a few basic aspects. The therapeutic relationship has clear boundaries. It's an agreement or contract. Therapy is intentional in that the agreement is to create positive change, though the client and therapist may have very different perspectives on what that means. Rather than a one-way communication, as in a classroom, it is interactional. Both people have to be actively involved. From this definition, therapy's historical antecedents are mostly religious. In such activities as confession, spiritual direction, and healing rituals, modern psychotherapists are heir to the intuitive practices of shaman, priests, and gurus. In the West, Anton Mesmer developed hypnosis in the 18th century as the first form of psychotherapy, 100 years before Freud. However, it is Freud, Jung, and Adler who became the main exponents of the talking cure. Cognitive behavioral approaches were developed in the 1950s with the work of Albert Ellis and Aaron T. Beck. About the same time, humanistic therapy and counseling developed through the work of Carl Rogers and Fritz Perls. These are the founding people of psychotherapy. But more recently, therapy has exploded with different models and techniques. What does therapy do? It helps a person resolve distressing symptoms. Note that in the first definition, I put quotes around the word symptoms. The word symptoms comes from a medical model and presupposes the person has some sort of illness. I believe the medical model is not appropriate when thinking about human psychology. Presenting problems are best thought of as a form of communication. They tell us that something is wrong, but not specifically what or why it is wrong. Therapy creates a supportive relationship within which the client feels heard and validated. Given time, even if therapy does not directly focus on problems, the client may feel better spontaneously. This is a result of a supportive and validating therapeutic relationship. Positive relationships are healing in and of themselves. Mood change, in a positive sense, is an inevitable outcome of moving through stuckness and developing healthy relationships with ourselves and with others. Third thing that therapy does is it supports positive change in how a person thinks, feels, and acts. And in that way, it increases their freedom from internal and external constraints. Think of freedom as our ability to make choices. And that freedom is restricted by external constraints of body, situation, society, culture, and education. However, we have more influence on these limitations than we believe. More importantly, we are most imprisoned by our way of seeing the world and the limitations of our attention, intention, and awareness. Therapy envisions the potential for choice and chips away at the constraining negative thought patterns, limited imagination, weakness of intention, and intrusive emotions that give rise to powerlessness. Finally, therapy helps develop self-awareness and self-control. Self-awareness is stepping into choice and making impactful, positive decisions. Resolve or will is the ability to hold and carry through a positive intention to create a positive quality of our life. If both therapist and client do not develop a capacity to hold and maintain a positive intention, a sense of purpose, therapy will tend to go round in circles. We have to have a shared vision of positive change. So let's look at key questions in psychotherapy. What is the nature of human beings? What are they like? How are they constituted? What are the important aspects of them? What are harmful and what are helpful experiences? How do we heal? How do we get damaged? And again, what kind of relationships are healing? What kinds of communication are therapeutic? And how do human beings change? Different models of psychotherapy answer these questions in different ways. For example, Freud's view of human beings is basically pessimistic. He focuses on how the id instincts around sex and death need to be sublimated, dragged out of the unconscious into the light of consciousness. In contrast, Jung's concept of the self, with a big S, is one of growth, development, and spirituality, though he also recognizes the dark power of the unconscious. Humanistic approaches tend to be positive and even overly optimistic, while behavioral ideas are more empirical and neutral. There's growing research and agreement about what are beneficial and harmful experiences, particularly early in life. We know that childhood trauma and deprivation has lasting negative consequences. For deeper change, a person has to address and hopefully resolve early negative experiences. In direct contrast to Freud, positive psychology focuses on all the ways good experiences help us create a better life. Therapists know that a good therapeutic relationship is healing. In a very immediate sense, we're all damaged in bad relationships and healed in good ones. As I've explained in a different video, trauma only creates damage if there is no healing environment. How we set up and maintain a therapeutic relationship tends to be very individual, though most agree on basic principles of respect, empathy, and validation. A traditional psychoanalytic approach restricts engagement, so the therapist, the psychoanalyst, does not speak very much, and this helps to develop the transference. There's far more disagreement between models on the nature and mode of therapeutic communication, from directive active to receptive passive. I will talk more about that in a subsequent video, which looks at the practice of psychotherapy, its techniques and interventions. When it comes to change, there's limited agreement on how human beings do change, and even what changes are important. In essence, healing and change are totally natural. We change every day, and our body and psyche are healing all the time. What is unnatural and problematic is when any human process gets stuck. We should be able to imagine and think and feel and act in endlessly creative and diverse ways. Healthy children, for instance, are fascinated with their own bodies and everything around them. They learn at an extraordinary rate and explore everything. But when a child or adult becomes filled with fear and unresolved pain, they get psychologically rigid and resistant to change. Our clients are always asking us to help them become more fluid and flexible human being, an ability which somehow they lost while growing up. So let's look here at the main therapeutic models. They fall generally into four categories: psychodynamic, which includes psychoanalytic, Jungian, existential, and more modern psychoanalysis; cognitive behavioral, that is a basic and fundamental approach to psychological change, which has lots of empirical research. But even cognitive behavioral has now expanded outwards into dialectical behavioral and acceptance and commitment therapy. The third main group or models of psychotherapy are humanistic and more recently transpersonal. So Gestalt therapy with Fritz Perls or person-centered with Carl Rogers are fundamental to the humanistic approach. But more recently, mindfulness and all aspects of the transpersonal, that means the beyond the personal, have become included. The fourth group is what I call solution-focused or strategic. And this includes Ericksonian psychotherapy, NLP, systemic family, and a kind of wide range of problem-focused psychotherapy. So a psychodynamic approach pays attention to underlying unconscious motivations and complexes. However, within the overarching framework, there are extreme differences between a Freudian and a Jungian, and even more modern forms. CBT focuses on thinking and action and how distorted cognitions affect what we do and experience. So CBT is more action and outcome oriented, using psychoeducation, homework, and other techniques. So a humanistic model typically focuses more on feelings, internal dialogue, that means talking to ourselves, how we talk to ourselves, and the development of positive relationships, and even our spiritual life. Solution-focused and strategic models think of the person as a living system, constantly changing with and balancing in relation to their inner and outer environment. It develops interventions that are focused on solving specific problems by helping a person or family reorganize patterns of internal and external relationships. Within each overarching model, there are countless flavors or adaptations of the model. In practice, there are few pure proponents of any particular model. Therapists, if they are trying to help clients, steal techniques and ideas from other models and from their own experience. Increasingly more integrative or expanded approaches to psychotherapy are the norm rather than the exception. Therapists are beginning to draw on things like Buddhist psychology, using concepts such as mindfulness and acceptance. Transpersonal therapy, for instance, actively integrates practices such as prayer and meditation. After all these years working with clients, I find it difficult to describe my own approach to therapy. I came to psychology through the works of Jung and trained in many different models: psychodynamics, CBT, client-centered, Gestalt, and Ericksonian hypnotherapy. My approach attempts to integrate many models and techniques, adapting all the time to the overt and hidden needs of the client. So integrative process psychotherapy tends to emphasize an open, collaborative, and engaged therapeutic relationship. It's not passive, it's active, but it can have some periods when it's more receptive. It's concerned with how the session feels and unfolds, what's called the process, as well as what is talked about, which is the content. It adapts each session to the nature and needs of the client. And this, of course, can be difficult in certain situations because certain clients have very specific needs, and we may not be trained in that particular model. It uses different models and methods of therapy depending on the client and the situation, and it includes and emphasizes, in some sense, the experience of the therapist. In this model, healing is natural, stuckness is unnatural. So we are always trying to find a method or means to help the client unlock their healing potential. Each person relates, communicates, learns, responds, and heals in a unique way. That is their personal process, a reflection of their inner nature. Rather than imposing a particular model or technique on a client, the therapist listens attentively to the spoken and unspoken communication of the client and responds both spontaneously and skillfully. Interventions arise out of the moment-to-moment needs of the client and are only restricted by ethical issues, the creativity of the therapist, and the willingness or resistance of the client. In a session, I might use different models and techniques depending on what I believe is needed in that moment. So I might focus on a symptom and how to get to grips with it. I might explore and interpret a dream. I might discuss difficulties in our therapeutic relationship or do a session of EMDR. Sometimes client and myself will agree to try some particular technique, such as hypnosis, but that can change depending on what arises for the client. After a greeting and maybe a short conversation about what's going on in the client's life, I get quiet and listen attentively to what the client tells me, that which is most on their mind. Then, depending on what the client brings and what I believe is going on, we will begin to explore the topic more deeply. In this integrative model, I think of 4 phases or tasks of therapy. These may be sequential, but they often overlap and sometimes they circle. The primary task is to form a therapeutic relationship in which the client feels listened to, validated, and has hope that their distress or their difficulty will lift. Hope is essential. Without hope, the client will feel lost and groundless. It's also important that client and therapist have a shared agreement around boundaries and expectations of therapy. The therapist needs the ability to develop the relationship quickly and to engage with the client in a collaborative healing process. Almost always, clients come to therapy looking for relief from distress of some sort: depression, anxiety, relationship stresses. These are problems they're unable to solve on their own without help. Our first task is to address their suffering and to do our best to resolve or improve the main issue, their presenting problem. Here it's useful to use models and techniques that are geared towards symptom relief. CBT, solution-focused approaches, psychoeducation, hypnosis, and EMDR are useful to quickly lower distress and confusion. I often suggest breathing techniques for panic attacks, exercise and sleep hygiene techniques for depression, and generally try to help the person improve their physical health and lifestyle through good eating and good exercise. Of course, if the number of sessions is limited through financial restraints, or if the client is young or only wants symptom relief, this may be the only phase of therapy. However, most often as the client feels better, they become interested in gaining deeper insight into their own experience and relationships. This is the insight phase. It focuses on self-awareness and self-acceptance, on resolving trauma, and exploring hidden processes. It helps the client understand the reasons why they don't feel good and why they act in certain ways, and most often includes exploration of childhood experiences and traumas. Insight-oriented therapy requires lengthier, more complex approaches. Humanistic and psychodynamic techniques become more appropriate. Sessions explore not only the what and how of experience, but also the why, the underlying motivations, the reasons, and unconscious intentions. Over time, each therapist develops their own style and techniques, which can range from psychoanalytic interpretation to two-chair gestalt work to somatic techniques. In my practice, I ask the client for dreams as a way of gaining insight into their hidden or more subtle psychic processes. EMDR allows me to explore and resolve trauma, while I generally use hypnotic techniques to help the client access unrealized inner resources and healing. My experience is that insight and deeper trauma work is most appropriate after a person has entered their 30s. Clients younger than 30 usually need to resolve symptoms and issues so they can get on with their life. However, if problems are more intractable, as with severe abuse and personality disorders, therapy has to be extended beyond symptom relief towards insight. Longer-term therapy geared towards self-acceptance is essential for these clients. More recently, I work with older, more mature clients, usually age 40 and above. They've mostly been in therapy before and have some sort of sustained spiritual practice. They're interested in delving deeper into their psyches, looking at more existential questions around the meaning and purpose of life and how to face aging and mortality. Again, dream work is my favorite approach, but we address how to manage and accept our own flaws and difficulties and what it means to live an intentional life. This, I believe, is the later stage of life, where we're looking for not just symptom relief, not just insight, but transformation of our being. Overall, the psychological maturity, ego strength, and intentions of the client determine the length depth, and quality of the therapeutic relationship. I've successfully worked with some younger clients in as little as 3 sessions. I saw one client with DID or multiple personality disorder twice a week for 12 years. Recently, I have sessions with clients weekly, 2 weekly, or monthly, depending on what works best for them. Some I even see on an as-need basis. I believe therapy is in the service of the client, and I try to accommodate the needs and inner nature of each client I see. So here are some questions to ponder that you can, as a therapist, grapple with. There are certainly no right answers. In our work, we have to confront mysteries and fundamental uncertainties about who we are and what we should be doing. So your first question is, what are my basic assumptions about human nature? What are my beliefs? Do I believe we are fundamentally good or fundamentally flawed? Do people come to therapy just to help themselves feel better? Or are there more profound reasons, such as growth and development? What drives us as human beings to both be so creative and so destructive? So what are your preferred methods of psychotherapy? And why do you prefer them? Have you chosen a method psychotherapy that suits your nature and values? Or are you doing therapy because that's what you were taught? Are you genuinely convinced that what you do is the right way to do therapy? And a very important question is, if you were your own therapist, would you be able to help yourself? What kinds of things has helped you change and grow? So think about what things in your life have helped you change for the better. If you understand why and how you feel and act, does it actually change those feelings and action? So you need to think about change in a very big sense. Have I changed gradually, or do I change suddenly, kind of like a wave breaking, and then everything shifts? So what do I need to learn to become a better psychotherapist? So do you have realistic views of your own skills and ability as a therapist? What are your doubts? What are your hesitations? What questions do you ask yourself about your clients? So we all want to become the best therapist that we can. So therapy is always a process of learning, of growing and changing, not just for the client, but for the therapist themselves.